It is the Wester Drug Health and Wellness Series. Good morning.
This morning we are welcoming Jason Flynn from Hearing Healthcare of Muscatine. Welcome, Jason.
Good morning.
So, Jason, Hearing Healthcare, basically all things hearing?
Anything having to do with the ears, and we're involved.
Okay, perfect. So, you're fairly new to the area.
Yep, we just opened our practice back in August. My wife and I, we lived in Nebraska for 17 years. Planned this move. Happy to be here. We narrowed it down to Davenport or Muscatine, and we're a smaller community, so the choice was pretty easy.
So, isn't Muscatine a great community?
It's beautiful.
Yeah, I grew up here, and I moved away for a number of years. Taught down in Missouri, and then when kids came along, my wife and I decided we wanted to move closer to home, and so she's from Fairfield. I'm from here. We moved here in town, and haven't regretted it at all. So,
Yep.
Tell me about your practice. So you where are you located?
We are out by the Fairway Grocery, so not too far from here.
Okay, off of Cedar or off
of Cedar Plaza Drive.
Okay,
the strip mall, right in between Edward Jones and H&R Block. So the strip mall, an easy location to get in and out of. So.
Okay, all right. And you said you've been there since August.
Been there since August. Yes.
Now it's you and your wife in this practice.
Yep.
So this is my own lack of education or naivete here. What is a private practice of? Are you a physician?
No, a licensed hearing aid dispenser.
Okay, so licensed hearing aid dispenser. Tell me a little bit about that. What does that private practice mean?
Well, we were in private practice in Nebraska for about 11 years, and basically, what that means for us here is we're not a corporate office. So a lot of the big corporate names, we work with some of those. So really enables us to work in behalf of the patient a little bit better.
So you're not owned by anybody else. You're standalone.
We are standalone, my wife and I, and we work in behalf of the patient, negotiate with different manufacturers to find the best hearing aid and device for the patient.
So you're not obligated to XYZ hearing aid or XYZ company for their product?
Absolutely.
Okay. So you are truly making a recommendation on what's going to be the most appropriate, best fit for an individual patient.
Yes. We've been doing that for years, and that's how we feel most comfortable to really give the patient the best service.
So how does somebody come about coming into your office? Do I just walk in? Do I say, I'm having trouble with my hearing? Do I need a physician referral? What does that require?
Any one of those referrals. We've had several referrals. We've had referrals from patients we've already helped here in Muscatine. We do some marketing pieces. We'll run some open houses from time to time. Walk-ins are welcome. One of our big, you've seen some of our advertisements is we're here for Muscatine. We live here. So it's much easier to give the service and be here, be available for the patient. So yeah, any number of those things. And certainly we can check the hearing and make a recommendation.
So is it, and I apologize because it has been years since I've had my hearing formally checked, apart from my wife's expert advice, I will say. My wife is very much an expert in telling me whether I hear well or not. But years and years ago, when I was in probably elementary school, they'd bring a trailer around and it was a booth, and you'd sit in the booth and by yourself and raise your hand if you hear a sound on one side or the other. Is it like that? Have things changed?
Well, the basic principles of a hearing test have not changed, but the equipment has, and the technology has changed dramatically. So that would be a hearing screening. So we do screenings, but when a patient comes into our office, a full hearing exam is what we do every time. So, and that starts with a number of things: video otoscopy, check the ear canal for wax. Video inspection, and then electronic testing. There's a number of tests that are done aside from just that initial hearing screening.
So video. So do you actually stick a camera down into my ear if I come in?
Yep.
Really?
Yep. You get to see it on the screen. So a lot of times patients come in and they wonder what could be causing it. They may think there's an object in their ear or wax buildup, and they'll see it on the screen. So there's no question as to if we can't see that eardrum, then either that has to be removed before we do the testing to get an accurate result.
And can you remove most of those things, or?
Well, it depends on what it is and how deep, but we do some wax management in that with the video otoscopy, yes.
Okay, so when you say the video otoscopy, essentially what shows up on the screen then, you're looking for an intact, good eardrum, and that's essentially what a physician's looking at when they stick the otoscope in your ear and take a look. Am I correct?
Yes, pretty much. The only difference is it's magnified about 30 times, so we get a very clear picture of what's going on.
So we can see it very well.
Yep.
Okay. Is it painful to have that?
Absolutely not.
Okay. About how far in does the camera go?
We can zoom in pretty close to the eardrum.
Really?
If need be.
Get right up next to it.
Yep.
Okay. All right. Now this is a question that I and I'm not even sure I've got a question to it, but I like to watch old television shows, and I think it's Me TV, I think is what it is. But you'll see commercials periodically for they tend to stereotype it and make it an elderly couple, and the lady is outside in her yard, and she's talking about how she's got this new device, and it's not a hearing aid, but it's helped her to hear, and her husband's hollering at her, "Where are my keys? Where are my keys?" And at the end of the commercial, he finds them, and she goes, "Well, I can hear what I want to." Now, are those types of devices? Are you familiar with those types of devices? And are they hearing aids? What are they, and how do they fit into the picture?
Well, there's a lot of different things out there, and a device like that, if it's just a general amplification device, there are some that can give a limited benefit. The big factor there is they're just an off-the-shelf type of product. So they have no idea what the hearing loss is. It's not programmed. It's not a hearing aid that's prescriptively fit for the patient. So, they have their place. We do have some devices like that available in our store. And certainly patients are welcome to try those things. Typically, that's where someone starts. And then once that they experience kind of the limitations of a device like that, then they typically come in and get tested.
So that's something that an individual obviously can pick up on their own if they're doing it on television, but there's no customization, there's no assessment of true hearing loss. Is hearing loss all the same?
Absolutely not. Absolutely not. I've had a little over 700 patients in Nebraska, and I always kid around. I say I've never had the same one twice, and you can have the same, what looks to be a very similar hearing loss, and have two completely different responses. So, no, there's a huge difference in hearing loss. Different types of hearing loss. There's conductive. There's sensory neural, mixed. There's a variety of things that can cause that hearing loss. So, pretty wide range.
So you threw out conductive and sensory neural. What are those, and what do they mean to me as average consumer or average patient? Well,
basically, it's where the problem is in the ear. It's one thing to have a hearing loss. It's another to know where that is being caused. So, sensory neural, typically you think of that in the nerve ending in the inner ear, and that's typically what we deal with. Conductive could be if there's some problems with the eardrum, if someone has had ear infections a lot as a child, and those things can also contribute to hearing loss. But nerve damage or nerve deafness, that takes place in the cochlea, which is sensory neural, which is most typical.
One of those three bones, little bones, right?
Well, sensory neural is in the cochlea. That's the nerve ending.
So you're talking strictly the nerve ending.
That's actually the electrical signal that's sent to the brain. So that is the most common type of hearing loss.
Oh, okay.
especially as we age. Presbycusis is just a fancy name for the aging process of the ears. So
okay. I won't remember that. So
yeah,
don't quiz me at the end of that.
Well, there will be a quiz, so we'll see how you do.
What about someone who works in a loud industry, whether it be a factory or I think about my kids playing instruments. We've got a son that's playing drums, and one of the first things the first thing that his drum teacher taught him was you got to have good hearing protection. So someone who's constantly exposed to loud noises, what kind of hearing loss is that? And what's the best way to protect yourself from developing hearing loss in that regard?
Well, can't say for sure what type of hearing loss. Typically that will be sensory neural, that you'll damage the nerve endings, those little hairs that, maybe we remember back in
Sure.
school that pick up the sound. Once those are damaged, they're irreparable.
And they're damaged just by constant repetition?
Repetition, noise exposure, a noise event, explosion, something of that sort. A variety of things can cause that. But your question about noise exposure, we're big proponents of hearing protection. Sounds odd to say. You think we're in the business of correcting hearing, but
right.
Protect what you have. Absolutely protect what you have. We did the Senior Expo a few months back, and we handed out free hearing protection. It makes it easier for us. Hearing loss is always going to be there, but protect what you have. It's easier for us. It's easier for you as the patient. So if you're going to be exposed to noise, even if it's something, even just a riding lawnmower, that could be around 80 to 90 decibels. You may think, well, that's not so loud. But the duration of time, if you're going to be on that mower for an hour and a half, that can take a toll.
Sure. I had a really good question there, and it just went away. It was along the lines of a single episode can cause. You mentioned explosion.
Mm-hmm.
Hopefully, none of us or extremely few of us are ever exposed to an explosion, but a single episode can cause the same damage as chronic year after year exposure to loud noises.
Well, it would show up in a different way, but yes, it certainly can cause hearing loss. So I've had a good number of patients over the years that have had some experiences like that. I had one in particular that had a battery. He was working on a vehicle and had a battery explode, and that did lead to pretty significant hearing loss in 1 year. So,
wow.
There's of course something like that you don't plan for, but
right.
Wear ear protection. Anyone can stop by our office at any time and get free hearing protection. We've got earplugs that we give out to the community for free. So.
Oh, really?
Yep.
Okay.
Yep. So
do you think that now you've been in practice? You said 17 years in Nebraska.
Mm-hmm.
Been here for a while now. Over those years, do you think public awareness has improved at all? How are we doing from an educational standpoint to let the public know about the importance of protecting their hearing?
I think we're doing better. Just general awareness about hearing loss has improved. I still think there's some maybe misconceptions about protecting your hearing. I know one in particular that comes to mind is it's not loud to me. My hearing's already damaged.
Oh, yeah.
They think, well, it's not loud to me. It's not, it's not going to affect my hearing. And that's untrue. That's just because it's not loud to you, it's still running through the hearing, and it can still cause damage. So I've had some patients that over the years have mentioned that. They think, well, I remember one in particular said, I can run a circular saw. He was cutting sheet metal. He says, it doesn't sound loud to me at all. And I say, well, it is to everybody else. So
that just proves that you need to come in and see Jason. So, folks, we're talking with Jason Flynn from the Hearing Healthcare of Muscatine, and we'll have him here for the rest of the hour. But for right now, we're going to step away for a quick break.
Welcome back to your home in the country, AM 860, FM 95.1, KWPC. It is 8:21, and we continue with our Wester Drug Health and Wellness series. Dr. Cory Garvin is here with us. Cory, what are you learning this morning?
I'm learning a lot.
You're learning that sometimes if I don't write it down, even when I'm interviewing, like it just goes out of my mind. How can that happen?
What did you say? I'm sorry, I didn't hear you.
Right. I was thinking about something else.
Make you an appointment.
That's right. Well, we're talking with Jason Flynn this morning with the Hearing Healthcare of Muscatine. And by the way, the phone lines are open, right, Millie?
They are 563-263-8600, or you can text in a question. And I did have someone who texted in a question.
Oh, perfect. We love those.
Do you want that?
Let's
go ahead.
Tee it up
here. We were talking about, people that have been exposed to noise, over a period of time. And does it have to be really loud noise? This one says, like someone who spends their life, decades, of driving around or being around semis, let's say. So if you're a truck driver, so you're not always in the truck, you're out and it's running and you're back in something, that kind of thing. Can that affect your hearing?
Sure. It goes back to, it's not just the level of volume, but the duration of time. Mm-hmm. So, again, if someone's been driving a truck their whole life, they've been exposed to a pretty significant duration of time, right, exposure of noise. So, that's something that can affect the hearing.
Do people ever use trickery to get folks to come see you? Do you know what I mean? Because some people are like, I don't want my hearing tested. It's fine. It's okay. I'm good. I'm like, do people ever trick someone into coming to see you?
I don't know if they've been tricked. I can tell sometimes it looks like maybe they wrestled with them to get them to come in. But
probably.
But we're realistic enough to, one thing I've realized over the years is no one wants to come through that door.
Right.
No one wants a hearing loss, and so we know that, and a lot of times there's apprehension. They have questions, and maybe they're afraid to ask them. So that's one thing my wife and I we feel we do pretty well. Is first off, we want people at ease, but sometimes there's some reluctance at times.
And what goes along with that is I know that for some folks there's a stigma about hearing loss or having to wear a hearing aid.
Yep.
So, you want to address that a little bit?
Well, it's one thing you've seen over the years that's really changed quite a bit. But yes, it's still there. Some of the newer technologies that made for iPhone hearing aids, and a lot of them are very discreet. Some are completely invisible, but there's still that stigma is there that it's only for the elderly. That's kind of like the last, now I have to get a hearing aid. And honestly, that really couldn't be further from the truth. There are numbers out, 18% of 45 to 64-year-olds have a hearing loss. So that's a pretty good chunk of people out there.
Almost 1 in 5.
Yeah. So
we're not in that age group yet, Millie.
Not quite.
No.
We're close. We're zeroing in on it.
That's our ongoing joke, Jason. Millie and I are the same age.
Same age.
Uh-huh.
We do fit in that category, just barely. But we like to think, maybe it's more me.
Yeah, it's way more you.
It's way more me, yeah. So that we're not. Yeah, so. Anyway, but 1 in 5.
Yep.
And those individuals are not elderly individuals.
No, not at all. And that we've had patients over the years from 18 years old up to 106, and so there's all kinds of ages in between. One thing, you think back over the years of comments people make, and they think a hearing aid will make them old. It kind of like it dates them, and I always ask them, well, isn't the not hearing making you old?
Sure.
Really, it just depends on how you view it.
Sure. Good point. So with you said that there are hearing aids that are basically invisible,
mm-hmm.
But there's still the hearing aids that wrap around the ear type thing. All those. How do you go about assessing what's appropriate for a given individual?
Depends on the patient's needs. Depends on their comfort, their ear canal. There are a lot of factors that go into making that choice. It's a matter of comfort for the sound, their hearing loss. There's a long list of things that can determine that. But like completely invisible devices, they're like a little mini implant, and you do get ones that can wear that. But obviously, if dexterity is an issue, that's not going to be a great choice.
Sure.
So you want to be able to.
I never even thought about the dexterity.
Yeah, if you can't
portion of it.
Yeah.
Yep.
We do have a caller. Are you
excellent.
ready?
Yep.
Caller, you are on the air with Dr. Cory Garvin and Jason Flynn. Do you have a question for him?
Yes, I do.
All right.
Good morning.
Hi. I am aware of hearing aids, and when I go to certain events or places, sometimes the sound gets so loud, I can go to my lowest setting on my hearing aid and it's still loud. What am I to do?
Is that hearing aid, is it programmable?
Yes,
I'm assuming it's a digital hearing aid?
It sure is.
Mm-hmm. Yeah. It should be able to be adjusted. Even that bottom setting, I'm assuming you have 3 different settings on that hearing aid?
I have 4.
You have 4. Okay.
Plus the different levels for the one setting. But you got to get so loud that am I injuring my ears by keeping them in, or what should I do?
Well, if it's that loud, I would suggest for the time you would want to take them out when you're in that event. But it needs to be adjusted. So if it's under warranty, you would want to have them adjust that hearing aid so it's comfortable for you. That shouldn't be an issue. If it's a digital hearing aid, that should be rather easily fixed. Yeah. It depends on the type, depends on what adjustments are available within that hearing aid, but just as a general rule, that should be able to be adjusted.
It would shut out the noise?
Well, you should, and again, there's a lot of different types of hearing aids out there, but will it shut out the noise? No. If the noise is there, the noise is there, but we should be able to keep you comfortable. So, when is the last time you had that hearing aid checked or adjusted?
About 2 months ago.
2 months ago.
I just purchased them at the Cadillac of the company I'm at. And I just feel like, am I damaging my ears by leaving it in?
Well, no, that should not be the case. If it's based off your hearing test, no, that shouldn't be the case. It may be just a matter of just kind of the initial transition here with these being so new. Are you wearing them all the time?
Yes.
Okay, good.
Can I ask a question?
You bet.
And you don't have to answer, sir. You don't have to answer. I'm wondering what event that you're in. Is it like a concert kind of situation that?
Yes, concert kind of situation, and also athletic events.
Sure.
Okay.
Sure. Yeah.
So pretty significant amount of noise. Yeah. Well, if it's a high quality digital, it should have features inside that would make that adjustable. And if it's not, we're equipped to service any make and model. Okay.
Thank you very much.
Absolutely.
Thank you for the call.
Does that mean, Jason, that some hearing aids and I have no knowledge of hearing aids other than I have a couple of loved ones who wear them, but I don't know anything about them. Does that mean that some hearing aids have, if you will, a filter that they'll recognize very loud sounds and can tune that down? Or what? How does this work? Yes,
that depends on the technology. So the hearing aids, while they can look the same or similar, there's only so many varieties as far as how they look. What's inside is what makes the difference. And this is, I always educate the patient on this. You could go to Walmart and buy a computer for $300, and you could go to Best Buy and spend several thousand. It depends on what you're going to use it for.
Oh, sure.
Right. So you're going to play solitaire. One may cut that. So, but yes, technologies can filter different sounds. They're called acoustic signatures. So they have automatic adjustments. They're dynamic, which basically to a patient, that means they interact with the environment that you're in.
So they're just going to do it automatically. The patient wouldn't have to worry about making many adjustments.
They shouldn't have to make many.
Okay.
Now, in the case of that call, it sounds like he's having some difficulty adjusting to the loudness and sound. So absolutely, you would want to adjust that hearing aid. Now, on the other side of the coin, an athletic event or a concert, that's pretty significant amount of noise too.
Right.
I mean, when I go to those things, I want to put earplugs in because they're so I kind of understand what he's saying.
Mm-hmm.
Yeah.
We have another caller.
Do we have another caller? All right.
Jason, you're a popular guy this morning.
Okay.
Stick around.
Perfect.
Hold on. Here we go. Good morning. You're on the air with Dr. Cory Garvin and Jason Flynn. Do you have a question?
Yes, good morning. This is Regina Day, and I never thought the time would come where I have to get our ears checked. I was going to get my husband a big funnel and me a big funnel and talk to each other.
Oh, Regina.
We get into more arguments than we ever had. Since he's hard of hearing and I've been hard of hearing for years. That's another story. And just one side. I would like to have the number of this gentleman and bring my husband in first, since I'm the younger one.
Sure. Make him go first.
So what is your number, please?
Our number is 316 6022.
6022.
Yes, ma'am.
And that is 563.
563. Yes.
Okay, 563 before.
Yes.
Yeah, we
Yes.
don't need that when we're here in this area.
316-6022.
Well, thank you very much, and I appreciate it. But now I'm just thankful our children are gone, because they would hear our yelling all the time. That would be not a good example. I yell enough as it is.
Regina, when you come into our office, we actually have a display wall.
Yeah.
And we do have displayed one of those old funnels that you're talking about. So if you, it's not for sale, but
Display.
Thank you very much.
Regina, thank you.
Sometimes, don't we?
Yeah, Regina, thank you so much for your phone call this morning.
You're welcome. Thank you for having that program. I appreciate it.
You're
Well,
very
thank you.
welcome. Bye-bye.
Bye.
Jason, she is
great.
the sweetest lady. You're gonna love
That's
her.
awesome.
she sounds like fun.
Yeah.
Jason, I've as we had the second caller, I was thinking about the first caller, and you had mentioned, you'd educated me that there are hearing aids that will, I'm going to call it a filter because I don't know the appropriate name, but they'll adjust based on some sound. But if the first caller, either his hearing aid is not set correctly or it doesn't have that filter, and he leaves his hearing aid in during an exposure to a loud, let's call it a concert, is he potentially continuing to damage his hearing? Because to me, the hearing aid should make it louder. Is that correct?
Well, in its simplest form, hearing aids amplify sound, yes.
Okay.
If the hearing aid is programmed correctly, it should have a ceiling programmed to where it caps the sound. There's a thing called compression, where it will suppress loud sounds. So again, and this is just generally, and I don't know till I see it on the computer screen to see exactly what's programmed within this, but will hearing aids make the hearing worse? No. But if he is in a loud environment like that, just even without the hearing aids, he should have ear protection.
Sure. Recently my wife and I were at a concert, and we were sitting fairly close to the big speakers. And I mentioned to her, I said, I forgot to bring my earplugs. And we talked about it a little bit, and I said, no, very loud sounds are now to the point that they make me dizzy. Is that, am I unique? Or is that, and I'm assuming that's at least a precursor to I'm losing some hearing.
Well, you are special, Cory. I'm just going to say that. Toss that out there.
Well, you were waiting there.
I know.
Yeah. Well,
Millie jumped on that one.
she did. She was just waiting for that. That was an underhand pitch.
Yeah.
Hey, I've got a whole nother half hour when we're done with this show. Another half hour with you, so I'll get even.
Okay. I'm waiting for it.
Well, to answer your question, Cory, you mentioned dizziness. That just struck a thought. If you're having episodes of dizziness or vertigo, or sudden changes in hearing loss, anything like that, that's kind of a red flag for the hearing, you would want to talk to your physician about that, or we can run a hearing exam and then refer you to the appropriate physician. But yes, noise can be so loud it can be overwhelming. And one thing made me think again. I always think of comments patients have made over the years, but when you walk away from a concert and your ears are, you say my ears are still ringing from that concert the night before. What's happening there? That's actually the nerve hairs dying. They're actually falling over, is what that is. So, So.
And when you said dying, so they're not coming back.
They're not coming back. No. So it's rather easy to cause permanent damage to the hearing. So they ring for a couple days. You're feeling the after effects. Now that may not show up immediately. You may not notice, hearing loss immediately, but a lot of times the hearing loss is in the makings over decades, and it'll surface again. And
so that everyone's on the same page, we're not talking that we have a dozen of these little hair nerve endings. We're talking thousands.
Millions. It's obviously it's a nerve ending. Well, one interesting thing about the cochlea is where these nerve hairs are found. The high frequency hairs are first. So a lot of times, and that's why a typical hearing loss will be a high frequency hearing loss. And if you've ever looked at an illustration of a cochlea, it looks kind of like a snail looking thing. If you were to roll that out, and all those hairs placed within the cochlea, the high frequencies are first, mid-range is next, and then low frequencies. So just by positioning, high frequencies are in line. They take a beating first. And so that is the most common type of hearing loss. Someone comes in and they have a high-frequency hearing loss. That is where they say, I hear fine, but it's not clear. The clarity in sound seems to be gone. Well, that would be that's first sign of high frequency hearing loss.
Is that why men can't hear their wives talk?
No, that's something totally different.
Oh no, but a lot of women's voices are on a higher, not mine, but on a higher register. So I wonder if that plays a factor sometimes.
Yes. Yeah.
You realize, Millie, that all your husband has heard is blank air right there.
Oh no, my tone's low enough. He heard way more than. Wait, let me say that in a lower tone right now.
No, joking aside, it is higher pitched voices. So women, children, consonants, even with any voice. So if someone says, say if someone has a high frequency hearing loss and someone says the word cat, there's a cat in my yard, the ka is a lower part of the word, but the t
sound. Oh.
Did they say cat? Did they say cap?
Right.
And that's where confusion comes in. If you're in a group setting, someone says so-and-so is deaf and you jump in and say, who died? Right. The consonants may be missing. And so that's just a matter of clarity. That's a rather easy fix hearing-wise. That's an easy hearing loss to correct. So
I think this is probably a great place for a break, but this is leading to so many other questions. So
I'm hoping write them down.
I'm hoping I remember them.
You better write them down. I'm bringing you a pen right now.
All right, perfect.
And we are back, 8:42, 4 degrees out there in the Pearl City. I've inspired Dr. Cory Garvin to be frantically writing down his questions. We are rejoining the Wester Drug Health and Wellness Series. Cory's guest this morning is Jason Flynn from Hearing Healthcare right here in Muscatine.
Yes.
Welcome back, everyone.
Good morning.
And my pen is about out of ink.
Oh, geez. You didn't take the one that I brought you. Poor Michelle. I don't know how she does it. No.
Isn't she fortunate?
Oh, yes.
Hey, hearing.
I have lots of questions. I don't want, so we were talking about it during the break. It's like, I have lots of questions. I don't want to monopolize the conversation though, but I do want to remind folks, definitely give us a call if you have a question. It's 263-8600. I have more people texting in questions that we want to make sure that we get to those as well. So, you guys tell me where you want to start.
Well, let me ask a question first, and then let's go to the text.
Okay.
So there's obvious potential safety issues with ignoring your hearing loss. But is there any health issues? If I ignore my hearing loss, it's not going to go away, correct?
No.
So, where do we stand there?
Okay. Well, there are numerous health risks that can be associated with hearing loss. Studies have been shown that patients are more apt for falls that can lead to increased risk of dementia. There's a number of different studies that can show different health risks. Your question about ignoring it, it's not going to go away. So ignoring the hearing loss will actually only really make things worse. And I've seen that over the years where ones have maybe put it off for 15, 20 years. They've suffered with this hearing loss, and now it's time to do something. Well, it makes it very difficult to convert the sounds back into speech. With the brain, once it doesn't receive those frequencies or those signals, it doesn't get speech the way it should. It's kind of like the brain forgets how to do it.
Oh, really?
And so, and the body's amazing.
You lose it. Yeah.
The body's amazing because then you'll get the lip readers and the body adapts, but it's very difficult to undo that. And it's probably one of the most common questions I get in the office is, what are the effects if I ignore it? And it makes it very difficult. And the frustrating part for us is, someone waits 20 years and then they do something. Now they expect it to be fixed.
Oh, sure.
They have high expectations, and it makes it very difficult. It takes a significant amount of time to try to help them adapt.
Sure. Okay. Millie, you had some questions?
Well, you guys touched on one of the text questions. It says they've been linking hearing loss to dementia, or increased chances of developing dementia or earlier onset of dementia. Mm-hmm. And they want to know, how is that possible? How does that work?
Well, if you don't understand what's being said, it leads to confusion. So there's
and then does your brain just kind of make it up? It's like, well, I didn't really hear all of it, or I don't know. Does
it fill in the gaps with what it thinks?
Yeah. It's kind of like we used to live down a gravel road in Nebraska, and if it's not traveled a lot, it kind of gets narrower, and the weeds kind of grow up.
Right.
And I think of that with the hearing. The ears just send the message, and if that path between the ears and the brain isn't traveled, so to speak,
sure.
With healthy hearing, then it kind of grows up with weeds, so to speak, and it makes it very difficult to understand. And so we do a series of speech tests to determine where someone is at with that. But the question about dementia, hearing loss is associated with confusion, paranoia. If someone doesn't hear, they can actually get to the point where they think everybody's talking about them.
Oh,
they're not a part of the conversation. So
right.
Sure.
And those are sad things to see someone go through. They need a lot of assistance to help them through that and
definitely
get their hearing back. And a lot of times you see that reluctance turn into a smile. So,
that was one of the most striking things because I've done a couple of talks on dementia and Alzheimer's, and the fact that what puts us at risk, and hearing loss came up, and that's so vital to stimulating the brain. A great way to help minimize our risk of dementia is the more we use our brain, whether it be crossword or puzzles or what have you. That brings vision into play and thinking, but also how we take in a message through our ears, through our hearing. So if we lose that sense, that sets us up for dementia. And to me, that I can't overstate that to my patients, the importance of that. So I think that was a great point to bring up.
Another text came in about so circling back to concerts and hearing loss and loud noises, things like that. Mm-hmm. They said, I've been to lots of concerts where people have small kids, and you've been there too.
Yep.
And it's a whole family, and some of those are really small children. And so I think sometimes people don't even think about hearing protection for
the little ones.
Yeah. I mean, it's something weird. I mean, we do when they're babies. But, by the time they're 6, 7, 8, 9 years old, we're not really thinking about that. And should it be on people's minds?
Absolutely. Ear protection, just some earmuffs. Sometimes at those events, I know I was thinking a couple years ago, I took my son to a monster truck
Oh,
So,
sure.
Talk about noise. Great for business, but but those are so loud. But I made him some custom earplugs to keep the sound out. So, but I believe at that particular event they were selling ear protection, which was great. But absolutely, you're going to have your kids exposed to noise, protect their hearing.
Another question just called in. Do you want me to keep going?
Absolutely. You're on a roll.
He wants to know, gentleman that just called, he was like, you can ask the question for me. He wants to know if it can be hereditary. A lot of other things in life are hereditary.
Good question.
I know. I was like, hey,
Yeah.
should get you on the payroll. I know. It's a great question.
Yes, hearing loss can be inherited. When a hearing loss is inherited and then you combine it with noise, then you have severe to profound hearing loss many times. But it's kind of funny though, because you can have 4 siblings and 3 inherited that hearing loss and one comes out scot-free. So
Sure.
It's not always the case. But if mom or dad had a hearing loss and you maybe have a brother or sister, absolutely get your hearing checked. And at the very least, that way you have a baseline to know where it's headed.
Do most insurances pay for, because we have a lot of things that we do like annually that were, eyes and the dentist and, like whatever, your physical. Does insurance pay for a yearly visit to you?
Different insurances will do that. Typically, we'll either through an expo or an open house event, we'll run a couple times a year where we'll have free hearing exams. So, and we do that periodically. So that's a great time. Get your hearing checked, check the ears for wax. And, we mentioned video otoscopy earlier, things like that. We offer those services complimentary a couple times a year.
What about Medicare, Medicaid? Do you guys do much with that?
Not Medicare, but Medicaid, yes.
Okay.
So different insurances. We work with all insurance companies. So sometimes if it's a product someone wants, they can buy it and then they can file the claim themselves too. So there's a lot of different ways to go about that.
Perfect.
Okay, hearing aids. And folks will come in the pharmacy and periodically, once in a while at least, those of us who don't have the hearing loss, and I'm counting myself in that group for now, but we can hear an individual's hearing aid whistle.
Mm-hmm.
Are those individuals not hearing it? Is it something that they've just been told nothing can be done about it? What's going on with those?
Well, to start, when I hear that, I kind of want to fix it right there.
Sure.
But they may or may not be hearing that. There are a lot of things that can cause a hearing aid to whistle, and this is probably, I would say, one of the most, if not maybe the second most common complaint. It's easily fixable many times. It's typically one of two things. It's either you could have a wax buildup in the ear, and what happens, the sound hits that wax, and then it bounces right back out and causes the sound to leak out. So that can actually cause whistling. That surprises people. The other thing might be fit. It may not fit properly. So
Okay.
Those are things that can be rectified most times, but a hearing aid should not do that.
And fit, that brings up a point. Obviously, what fits me is not necessarily going to fit my friend. And so,
Like you can't get one of these used.
that's where I was going.
Is what you're
Yeah,
saying,
you wouldn't
right.
necessarily, you wouldn't want to use
Wouldn't want to
used
borrow
one.
someone's.
No, that doesn't work out. To start, it's not programmed for your hearing loss. You could cause some damage to the ear canal. It could make the ear sore. Yeah, there's a lot of drawbacks to that.
I've also heard the argument that I had a friend that used a hearing aid. It didn't work for them, so therefore I'm not going to go down that road because it didn't work for them, so it won't work for me. How do you address that?
Everybody is different. There's I mentioned earlier, hundreds of patients never have the same one twice. So don't ever define someone else's success or failure for yourself. So your hearing loss is unique. Where you go is unique, and maybe they weren't fitted with the right hearing aid for their hearing loss. So there's a lot of factors in that as well.
Can I tell my? Go ahead.
No,
Cory.
go for it.
I want to tell my story from last night. So I'm sitting around and I like the Food Channel. So I'm watching Cake Wars. Why not? And one of the judges, he turns just enough that, and you would really have to be paying attention, that he had the tiniest little hearing aid I've ever seen. Like literally nothing was sticking out beyond his, like I'm DVRing everything. So I had to like freeze frame it and stare at this thing.
Oh, sure.
Knowing that you were coming on, because I'm thinking, because you talked a little bit about dexterity. And I think to myself, how would, number one, he get that in his ear? But number two, how does he get it back out of his ear?
If it can't be seen, how do you?
Yeah. So help me understand that. And I never realized they were that tiny. I mean, like right in his ear canal, nothing really visible sticking out from his ear.
Yeah. Yeah, that particular style is what's called an IIC, invisible in canal. So those fit down past what's called the second bend in the ear canal. So they're very deep insertion fitting, completely invisible. The only thing that is visible, if you do look extra close, if you zoom in with your TV, they're right at the edge of the ear canal. There's a little removal handle, and they're taken out that way. There are some others out there that have a little tool to take them out as well, but those kind are actually surprisingly easy to get in and out. But you want a patient to have good dexterity to change the battery and things like that. So,
I guess I think of them like glasses. I have glasses at a very early age as a child to correct some vision issues. And I think my hearing is just like my vision. If I couldn't hear, I would be missing it. I would totally be missing it. It's kind of like my vision now that I am Cory's age. And
23.
And yes, and I need to look at things a little bit further away than I used to, like that whole thing.
Right.
I was at the eye doctor immediately going, you got to fix this. Because I want my vision to look like it used to, kind of thing. Mm-hmm. And so do you hear that a lot? Because Jason's wearing glasses right now, and it's that whole, I don't understand why people are so against or, I'm not getting a hearing aid. Mm-hmm. When we so readily embrace other things, glasses or.
Yeah. Yeah, I think it's not so much always the reluctance, but it may just be the lack of awareness. Hearing loss is so subtle. So, if it happened overnight, you'd have people come in and say, I need this fixed right now.
Right. Oh, sure.
I want it yesterday. But it's so gradual that it's not always noticed by the person that has the hearing loss. And that is an interesting point. I would say almost always it is someone else that notices the hearing loss before the individual does.
Sure.
Because the individual says, well, they were walking away. They were walking away from me. Or I don't like to hear in a restaurant anyway. So,
they weren't looking
or
at
this
me.
person mumbles. Yeah, that person mumbles.
Mm-hmm.
But it's almost all the time. In fact, I'd almost say 10 out of 10 times. It's the mate, it's the children, it's someone else that walks in and says, oh my goodness, why is the TV at 75?
Right.
They notice that. But it's so gradual that they're not always aware that it is so bad. And then when they finally do something about it, then they realize when that TV comes from 75 and it goes down to 20.
Right.
Then they realize, my goodness, the whole neighborhood could hear.
We're all watching the game together.
Yeah.
So we're just about done, but a couple of points that I'd like you to educate us on. Let's take the individual who has a hearing aid. How often do they need it serviced, or how often do they need to see you? What kinds of things can you do for them?
Depends on what the patient needs. I've seen some patients every month, every 3 months, a couple times a year, and then you get some that need little service at all. You want to have your hearing checked annually.
Starting at what age? Or once you get a hearing aid? Or?
Well, once you get a hearing aid for certain, but if you're 55 or older, so 55 and up, so you guys are in the clear. So just
we're not there yet, Millie.
You're okay.
Wow, it was so nice of him.
He jumped on the bandwagon, didn't he?
He paused briefly, like he wasn't sure. Maybe, I don't know.
But 55 and older, have your hearing checked annually. Even if you don't think there's a whole lot going on, you may think, man, my hearing's totally fine, and that may be the case. But at least you have a baseline, so that way if something does change. And then, of course, if you're having any symptoms, if you think people are mumbling, we mentioned some of those things. The TV volume's too loud, ringing in the ears, anything like that would be a good indicator you want to get your hearing checked. Okay.
And then to get the hearing aid clean, can most folks clean their own hearing aid, or do they need to come in to see you?
Most can clean them themselves, but we have a cleaning station. We service all makes and models of hearing aids. We've been doing this for years. It's one thing to have a hearing aid or own a hearing aid. It's another thing to keep it working well. So,
sure.
We've been servicing a lot of hearing aids here in town, and ones that were not purchased from us. But it's a lot easier to. I always think in illustrations. I think it's easier to change the oil in the car than get a new motor.
Sure. Yeah. Right.
So sometimes some simple maintenance, some cleaning, and we can improve things quite a bit.
And where are you located again, Jason?
We are out by the Fairway Grocery in the strip mall. It's 2016 Cedar Plaza Drive, Suite 6.
Okay, and the phone number to get a hold of you?
563-316-6022.
Now, do you have a website?
We do. MuscatineHearing.com.
MuscatineHearing.com. Do folks need an appointment to come see you? We talked earlier about whether they need a referral or not. You suggested that they don't necessarily need that.
Typically, depending on what we're going to do, we'll take walk-ins. Appointments are good. We don't like to keep people waiting too long if we already have appointments running through. So give us a call. You can stop by. You can jump on our website, send us an email, questions, anything like that. We're here for Muscatine.
What are your hours?
9 to 5. Monday, Wednesday, and Thursday, 9 to 5. Tuesday, Friday, we do appointments.
Okay. All right. Folks, we've been talking with Jason Flynn from Hearing Healthcare of Muscatine. His phone number is 563-316-6022. Appreciate your time listening in today, and we'll be back on Thursday to the Western Drug Health and Wellness Series.